Millions of Australian workers are in line for a pay rise today as the Fair Work Commission's annual wage review comes into effect. The minimum wage will increase by 5.2%, roughly an extra $40 a week for workers. Those in healthcare and social assistance, accommodation and food services and retail stand to benefit the most from the increase. Joining us live is the Secretary of the New South Wales Health Services Union, Gerard Hayes. Gerard, good to see you again. Thanks for joining us. So your members must be happy that this pay rise is coming into effect today, and I have to say that your union has been probably the most positive about the 3% offer from the state government.
Yeah, that's right. So we're very pleased about where wages are moving for people who are on very, very meagre salaries. And it's always very important for us, not only that our members and the communities that they're in can actually afford to live and afford to contribute to the economy and to the community by buying goods and services. So I think this gives people a platform now that they can actually live from. And then also in terms of the recent 3% plus $3,000, we are satisfied with that this year. I think it goes some way as a one-off payment between 6% and 9% for some of our members, but we're still looking for that overall award modernisation so we can ensure productivity in terms of the awards as they should be built for 2022 and beyond, not we're dealing with 1970 up to about 2000.
Okay, so you're happy that with the current rate, but also that there may be more pay rises based on productivity outcomes?
Oh, look, it's really important that we can do that. You look at paramedics now who, through early intervention, can resolve a clot in someone's heart in their home. Now, the back-end saving to that is ICU beds at $10,000 a day. A person's not going to be in that bed for a week, and then potentially, if they've got some kind of cardiac damage, become an infirm person that relies on the health system going forward. So, and the qualifications and skills that paramedics, as a range of other health workers have now, really goes some way to be able to address those back-end savings. But we're still dealing with awards which are just basically made in cement and haven't moved for many, many years.
So New South Wales Health Minister Brad Hazzard has said that the government would not consider offering a further pay rise on top of the 3%. So that's okay with you at this stage?
At the moment, sure. That's what we're dealing with the here and now. What we intend to do leading into the 25th of March next year is put a lot of pressure on to be able to ensure that either the Liberal Party or the Labor Party, whoever wins government, is going to deal with awards in a mature, sensible way, as opposed to sitting in a corner saying there's a percentage point. However, young people now have developed skills and qualifications that were never imagined when these awards were written. And so we're not dealing with any sense of reality. So that's what we're trying to have, a mature debate and mature discussion. And the productivity that is produced by our members, the community will be better off for it. And I hope that the government of the day next year appreciates that.
Well, you just mentioned that you're going to be putting the pressure on leading up to March next year. There have been claims that unions have been getting together and creating these coordinated attacks where everything's happening in the same week and that it's politically motivated. How does that sit with you, some of that commentary?
Again, I think it's pretty childish, to be honest with you. Like the unions that are currently taking action this week, the R2B is affiliated, the teachers and the nurses are not affiliated unions to the ALP. So I think we need to get ahead of this scare campaign, because I won't speak for other unions, but certainly our union doesn't seek to create problems for the community. In fact, we appreciate everything that the community's done over the past 2 years in respecting our members because they've worked so hard. So I think we've got to try to get to the point of pulling the politics aside and let's deal with the real issue. And the real issue is, one, workforce. To a large degree, if people don't want to have a serious discussion about wages, people are just going to move to other organisations who are just going to offer more because there's such a shortage of workforce at the moment. So there's a key opportunity to have a mature approach to industrial relations. I'm not seeing that happening with the government at this time. And while the government's done a lot of good things...
Are you seeing it happening with the opposition? Because Chris Minns, the opposition leader, he's refusing to put a percentage or a dollar figure on what he's going to be offering public sector workers. Are you confident that he will deliver what the unions want, or is that what you're after?
Oh, not and not at all. Like I don't think it's any secret that I've had my fights with the ALP as well. I want good leadership for our members and their community. So the Labor, we would attack Labor just as we would attack the Liberal Party if we can't get a sensible outcome here. And we cannot sit back and say there's 3%. CPI may be running at 5.5, 6%, but we just say it's 3%. Well, I think we can be a lot more intelligent than that. And it just shows me, though, at this point in time, there is a lack of expertise in relation to industrial relations at a government level, which is a major concern to be able to get outcomes that they're going to appreciate, be appreciated, whatever.
Premier Dominic Perrottet, he wants to increase fines for strike action by unions that defy Industrial Relations Commission bans to $55,000 on the first day and $27,500 every day after that. Yeah. Is that going to have much of an impact in stopping industrial action by unions, do you think?
I don't think so. It's and I'm not going to suggest that unions factor this in as a way of doing business. But unions generally do not take strike action lightly. Our members are not on huge salaries, and so losing a day's pay, it's not a view that I take that I like people to lose money to get money. By putting increasing fines like that, it's just saying that, okay, we have an inability to be able to negotiate these outcomes. So we're just going to put fines on. So everyone ratchets up their position. The heat gets hotter. It doesn't go to any form of resolution. I'd like to bring people together as opposed to being sort of apart at the moment. It just seems to me like that the abyss is starting to widen and doesn't need to be that way.
The budget included billions to hire more than 10,000 extra healthcare staff to ease pressure. Are you confident that they're going to be able to deliver that?
I think it's going to be really hard. In some respects, it will be able to be achieved. So paramedics, for instance, the university have been pumping out a lot of young people, giving them HECS debt for years, and the jobs just haven't been there. So there is a workforce out there who will be able to be absorbed pretty quickly. I think other areas such as allied health, there's the same thing. You'll see a lot of postgraduates who can't get allied health positions, so you'll be able to bring people on. But there will be other roles, particularly regionally based, how you get people to actually relocate or want to live regionally. Once people do that, they'll appreciate that it's a great place to live, but getting people to do it in the first instance is a bit of an issue. So it's not going to be as easy as just saying that there's the number and it's all in the working it through. And I think that's going to have a lot of work to be done on it.
Gerard Hayes, appreciate your time this morning. Thanks so much.
Thanks so much for your time. All the best.
Talk to you again soon.